Hello, everyone. I'm Jody Tropiano, the head of content for health, and I'm here with John Cordier, the CEO of Epistemics, and an advisor to the Techquity for Health Coalition, launched by our own health foundation. Great to have you here, John.
Yeah, glad to be on. Thank you.
So let's dive right in. So the Techquity for Health Coalition did a survey of the industry, which we'll get to. But before we do that, can you please first just say what Techquity is?
Yeah, Techquity is intentionally designing, developing, and distributing health technology to advance health equity. The group is also focused on avoiding deepening existing inequities and health disparities. And where we play in this space with Epistemics, when we look at Techquity, it's really the integration of technology and data, how they go together, data collection, and how all the different types of data analytics are included as part of the scope of Techquity.
Excellent. And so getting into the survey a bit, can you tell us what you were looking for, who was involved, anything more you can share?
Yeah, well, as far as we know, this was the first ever healthcare industry survey of Techquity. So we invited people from managers to C-suites to participate. And there were four main objectives of the survey. So the first was, do people know what Techquity is? Have they heard of the term before? And so we're looking at gauging awareness and the perceived importance of applying technologies to improve health equity. So that was the first thing. The second thing that we were looking for was an understanding of if and how other healthcare organizations are taking action and applying technologies to support improving health equity and or social determinants of health or population health, whatever it might be for that organization's language that they're using. And another key part of what we were doing is looking at the organizational level, is Techquity integrated into their overall strategy? And finally, we were looking for the respondents to understand if their organization is doing something that is related to Techquity, how successful are those efforts and how are they measuring success of technologies applied to improve health equity?
Excellent. And so of all of that, were there any really surprising or key findings?
Yeah, I'll start with some of the more positive ones. So we found that most respondents were either already familiar or had some other frame of reference to what their organization is doing under the lens of Techquity. And about 2/3 of organizations are at least working on some initiative to improve health equity, Techquity, or DE&I. And of the positive side, there's also a number of organizations that are establishing community-based partnerships. And the important thing here is when you're applying or using a new technology in a community, can you work with the community to make sure that the health tech is more user-friendly and promotes digital health and digital literacy? So all of those things were really positive from what the survey found. But there was somewhat of a point of tension where there was somewhat of a lack of knowledge, commitment, and even resources that were getting invested in health equity initiatives. And ultimately, I think a lot of organizations also identified that there's a gap on how to use data to address health disparities and health equity.
Yeah, well, that's great. It's a great first step. So the Techquity for Health Coalition was launched in January, so many people in healthcare may be unaware of it. So can you just walk us through the general aims of the coalition and where you see it going in the near future?
So some of the things that we're focused on over the next, as I understand it, over the next 6 months to a year, developing best practices, developing standards, understanding metrics that healthcare organizations can rely on to make sure that Techquity is brought forward, and that when they are launching a new product, a service, or technology, that they do have a lens of equity in mind as those things are getting launched. And we're going to be launching 3 specific working groups, and the working groups are focusing on outreach. So how do we look at educating and informing practitioners, executives about Techquity? The other group that we're forming is all about standards and metrics. So the important part here is how do we engage with what's already going on in the industry? And we know that there are many people working on health equity and social determinants of health in healthcare, but we want to pull their collective intelligence together so that we can build those things into, build their knowledge into standards that others across the industry can adopt. And finally, we have a group that's going to be focused on monitoring our progress so that we can continually share all of the good work that we're finding from other organizations and the good work that people who are part of the coalition are doing, so that organizations can learn, adopt, and understand Techquity practices and how they compare to their peers. So if others are interested, you can email info@HLTHfoundation.org. We have a great team ready to look for others to join the team, and that's the best way to do it. So info@HLTHfoundation.org.
Yeah, well, we'll make sure that email gets out so everyone has access to it. And I can sense your passion. I really appreciate your time with us today. And if we had more founders like you, then we'd probably be in a better place overall. So thank you so much for dedicating your time to this.
Yeah, thank you, Jody.